Hey, Mr. Thornton, I'm Regina Williams. Today my patient will be TJ Williams. He's actually my son, and he's going to help me with this video of using the ophthalmoscope and the otoscope. I would start by getting his past medical history, his allergies, and the reason for the visit. And I'm going to go ahead and move into using the ophthalmoscope. And so actually I would start by looking at the conjunctiva and asking if he's had any trouble. Look up for me. Look up again. If you had any trouble with burning or itching in your eyes. He's got a little periorbital irritation, looks like maybe from allergies and maybe seasonal allergies. And now I'm going to look at his optic disc and hopefully the macula and the veins that stem out from the optic disc. TJ, if I can have you look straight ahead, see that little tumoring thing right there. If you can look right at that for me. The light's a little bit bright. Let me know if it gets uncomfortable for you. And first I'm going to try to visualize and get the red reflex, and then from there I will try to move in. Okay, and I can now visualize the optic disc and going up and in. I can see the superior nasal, the inferior nasal vein, the inferior temporal and the superior temporal. You okay? And I will do the same thing on the other eye. And again, I'll move in. I'll see the red reflex and keep looking straight ahead. And I can actually visualize that now, and I can see the optic disc. And going up, see the superior and the inferior nasal veins, as well as the superior and inferior temporal and the macula. Okay, and I'm going to let his eyes rest for just a minute, and then I'm going to see how his pupils react, and to make sure that they equally react. Okay, and just look straight ahead for me. I'll get the reaction of that eye, and keep looking straight ahead, and the consensual reaction, which is equal. Keep looking straight ahead, and reactive there. And again, open your eyes, look straight ahead. And consensual. As you can tell, we're just a little bit silly. That's okay. I guess at this age you're supposed to be. And now I'll take a look at his ears. Have your ears been hurting? Anything been bothering you? No? Okay, and put your head straight ahead. Alright. Does it hurt if I wiggle your ear right here?
No.
Okay, moving the auricle is not painful for him at all. And I'm able to visualize the tympanic membrane. There's no redness, no bulging, doesn't seem irritated at all. It does have a lot of wax build up in there. And I'll take a look at the other side. Yeah, for me. And again, looking, I can visualize tympanic membrane. And the cone of light. The tympanic membrane is a pearly gray, no redness. It's not bulging. There doesn't appear to be any fluid behind it. And now let me look in your mouth. I don't have a tongue blade, but when he does that, I can tell that he's a little irritated in the back of his throat. Do that one more time. And it looks like more from a post-nasal drainage. Alright, open your mouth again. And the soft and hard palate don't reveal any kind of lesions, no redness, no problems there. And inside your mouth, lift your tongue up for me. Here you go. And put it to the right side and the left side. And if I had a tongue blade, I would go ahead and do an oral evaluation just to make sure there were no sores and no lesions that have had trouble healing. I want to look at his nose now, see if there's... he does have a deviated septum on the left nair. Look like maybe just a little bit of swelling. I know because I'm his mom that he does have a lot of trouble with allergies, and we are a bit flared right now. His skin is actually really dry from eczema that he has and from his allergies. But other than that, everything looks great. Hope I did okay with this, and thank you very much.